question
Yeah.
to kind of piggyback off of that, because it sounds like what you're saying is kind of cultural competency is very important, but then also respect. So is there something that people can do to kind of increase that cultural competency so that they are not a barrier, so that you are not coming in between a patient getting the best care that they need?
Yeah. So first, let me say, I think there's nothing like having a diverse workforce. I may have said that 3 times. I'm gonna say it again another 3 times. Because you can give these workshops, and I agree with giving cultural competency workshops, but there's nothing like working next to someone that is transgender, that is a cisgender black woman, or a Asian American male. The more diverse you are, the more you can have real conversations. And it's not real conversation about medicine and how to treat this case or that case, but it's conversation about your family and
your humanity.
Your humanity, And you realize, wow. So then, when the trans woman walks in, you don't have this. Who is this? This kind of foreign kind of relationship with them, because
it's organic.
It's organic. Yeah. You work with this person. You just had lunch with this person.
Right.
And it wasn't that person. It was a person that looked like them.
Yeah.
And so I think the more diverse the workforce is, the better off, or the better feeling the patients will have that is genuine, that they are genuinely respected and cared and are cared about. The other thing that could happen is just real live workshops.
Yeah.
Like there's nothing like having a trans organization come in, give a workshop, give their experiences. Nothing like having a cultural competency workshops. They don't take the place, of course, of, I'm talking about not an either or, but an and. Now the other thing that I think this really needs to happen is really legitimately having some open conversations, like amongst the medical staff and the teams, and having people to share their own experiences. So you'd be surprised when you hear black women talk about not feeling heard when they go to their providers. And you think, wow, that's Dr. So-and-so. Well, how can she not be heard? Well, because people, when they look at me, they don't look and see a black female physician, right? They think, maybe I'm a software tech person, or maybe whatever, but they don't think that I'm a physician. And so having that conversation and recognizing that as a man, there's certain privileges that I take advantage of that I don't even know. That people will assume that I'm a doctor and I just have on my coat. Now, being an African American male physician, that's a little bit different, okay? But in general, there are challenges around how we relate, how the medical workforce relate to our patients. And I think the more we can have honest conversations amongst each other, and that means some uncomfortableness about conversations that we might need to have with our colleagues to say, yes, I get pulled over by the police for no reason. And they need to hear that, because then they can say, well, that's never happened to me. Like when I share that with my colleagues and they say, what do you mean you got pulled over? What do you mean? What'd you do? Nothing. I just was driving home. And they just, they can't believe it, and they get livid and they get upset, and I'm like, but that's my existence. And so I think the more we can have honest conversations like that, the more we can have trans people come in and talk about their experiences, have our LGBT brothers and sisters come in and talk about their experiences, and have us, whether you agree with the lifestyle or not, when you're in healthcare, your job is to take care of patients. And so anything that gets in the way of that becomes a barrier, and the patients already have enough barriers. They don't need, it's the one place that they should come to that you're not concerned about if they're sleeping with a man or a woman or whoever they're sleeping with. They should not have the feeling that you're making a judgment on them. And I think that we are getting to the point where that's happening, but we have to normalize it a little bit more. I have seen where there are certain places that people still feel violated and vulnerable, and nothing overt. It's always covert. It's always, go have a seat over here and we're gonna figure out what to do with you, right?
Yeah.
That's not said, but it's implied.
It's implied.
So, but many times it's a matter of exposure. So it's emergency rooms, it's urgent care centers, it's some primary care centers where they're not used to seeing a diverse population. And I just think we need to just start to have more honest conversations, have more trainings, and of course hire more diverse staff.